for Education.
Thank you, sir. I'm pleased to rise on this motion on behalf of the government and indicate our support for the motion for the most part. I thank the member for Mount Gambier for bringing the motion to the House and recognise in particular his long-held level of concern and focus on these issues, not just in the 7 years that he's been in the Parliament, but I know through the people I've spoken to of his engagement in schooling around the southeast and Mount Gambier and other parts of the state, where of course the member for Mount Gambier had previously also worked hard to support the mental health needs of students in regional and rural South Australia. In supporting the motion, I do indicate that the government wishes to offer what I hope will be an uncontroversial amendment in which I've spoken to the member for Mount Gambier about, and he can indicate whether or not he's comfortable with it in his response, but I certainly got the impression from him that he didn't object to it. Of course, I'll start with that amendment and then reflect more broadly on the motion, because in A and B, the first two parts of the motion, the government unambiguously supports and is absolutely committed to those, to an agreement with those. In C, I think we have a better way to express what C is seeking to determine. Of course, we don't appropriate funding through the motions part of the House's work, and indeed there are a couple of programs in place that I think it's appropriate to acknowledge the investment that is in place, and indeed through those investments some of the specific examples that the member for Mount Gambier has brought, and I'm sure others will bring as well, can therefore be reflected on in the work that the Department for Health and the Department for Wellbeing are going to be undertaking, and indeed will be in place for the people of rural and regional South Australia. I therefore, particularly the three areas that the member for Mount Gambier reflected on, and this I think are captured in his intention in C and certainly are captured in our proposed amendment to C, to ensure that funding and investment in rural and regional mental health services is present, that workforce development issues are put as a very heavy focus. Of course, the member for Mount Gambier identified some of the challenges in those areas, and meeting those challenges requires that work to be done in long-term thinking and indeed long-term strategic thinking about the process altogether. The motion refers to a 5-year strategic plan in the proposal, and the amendment recognises that. So I would therefore seek to amend the motion as described, so that the motion would read as follows: the Parliament recognises the significant effects of the COVID-19 pandemic on the mental health and wellbeing of South Australians. B, ensures regional South Australians, with the unique challenges of living in rural and remote areas, are a strong focus of future planning and funding commitments. And C, acknowledges the Marshall and Morrison government's combined approximately $100 million investment towards new mental health initiatives and services in South Australia, and welcomes the implementation of the Mental Health Services Plan 2020 to 2025 and the Rural Health Workforce Strategy, the long-term strategic thinking that is necessary, and the workforce strategy that is, I think, central to the intent of the member's motion. And so I've got the hard copy here if one of the attendants would like to circulate that. As I say, I believe it's intended to be uncontroversial, but just perhaps to express the intention of the motion in a manner that we feel is slightly more appropriate. Now, this motion is important because it gives the Parliament an opportunity to reflect on this important issue, and indeed the government the opportunity to engage constructively with the member for Mount Gambier, and indeed all members, to provide their suggestions for the consideration for that investment that is coming. We know that the negative effects of drought and bushfires, in addition to the pandemic, on the mental health and wellbeing of South Australians is significant, and that is particularly evident for those living in regional areas of South Australia. Recent data reported by rural and remote mental health services indicates a 23% increase in calls to the Emergency Triage Liaison Services phone line and a 17% increase in presentations to community mental health services from January 2019 to December 2020. This has been further highlighted through the COVID-19 mental health support line established in April last year, which has received over 4,800 incoming calls, more than 2,000 ongoing support calls and support for over 10,000 people in hotel quarantine. The continued demand and uptake of mental health services across all age groups throughout COVID-19 highlights the impact the pandemic is having on the mental health and wellbeing of the South Australian community. The government has responded to the needs of regional South Australians by providing funding to increase clinical staffing in the rural and remote mental health emergency triage and liaison service and the older persons mental health rapid in-reach service. The increased demand is being closely monitored, and this funding will be maintained while the need remains. Access to mental health services for regional South Australians has improved in recent years with technology, increased awareness and reduced stigma relating to mental illness, and better understanding of the impact on mental illness on individuals, families and communities. A substantial improvement enabling better access to mental health services to country residents is through the digital telehealth network. The platform has brought clinical assessments and care to consumers living in the most remote areas of the state, in addition to a range of other supports and services. Given the established technology, our mental health teams were able to offer regional and remote consumers a seamless service transition during the COVID-19 shutdown using existing digital modalities such as the digital telehealth network and trialling new platforms for delivering services remotely. Evidence suggests that care close to home improves outcomes for all consumers of health services. Reducing travel to Adelaide for regional consumers is a key benefit, enabling greater family and carer involvement and support. Within regional mental health, 3 integrated mental health units, each with 6 beds, are located at Whyalla, the Riverland and Mount Gambier. These mental health units have supported evidence-based care and provided a vital expansion of countrywide acute mental health services. These facilities have supported consumers and carers with high-level acute care, including a stepped model of care closer to their homes. Positive feedback from consumers, carers and the community support the integrated mental health unit as a welcoming and calming environment for therapeutic care. This model of regional inpatient care has also reduced pressure on metropolitan services. A constant focus of rural and remote mental health services on recovery for country people from mental ill health. This focus is on the form of provision of clinical support to all regional local health networks and a program of continual review and evaluation to explore alternative opportunities to enhance recovery services. The rate of suicide by South Australians living in regional areas compared to metropolitan residents continues to be an area of concern. Wellbeing SA is now responsible for the implementation of the South Australian Suicide Prevention Strategy, which includes supporting existing suicide prevention networks and establishing new networks in addition to developing a new state suicide prevention plan. Wellbeing SA works with rural and regional organisations to engage local communities in establishing new suicide prevention networks. The regional local health networks are working with the Office of the Chief Psychiatrist, together with rural and remote mental health services, to form a Towards Zero Suicide Steering Group to implement a consistent and comprehensive zero suicide strategy in regional South Australia. The evidence further indicates that people who have experienced previous traumatic events prior to COVID-19 or indeed bushfire, drought, are at greater risk of having mental health concerns following a subsequent event. The risk was realised after the Adelaide Hills and Kangaroo Island bushfires, with an immediate increase in the acuity of existing mental health consumers, and at the onset of COVID-19, these communities have required a comprehensive and specialised clinical mental health response to mitigate a second layer of trauma. The Marshall Liberal Government responded by providing specific funding to employ 5 additional clinicians across both areas for a 2-year period. Further supports have also been provided in response to the bushfires, including funding for Wellbeing SA to work with communities in co-designing plans and activities to strengthen their mental health and wellbeing. Addressing mental health and wellbeing in peri-urban and regional communities goes beyond having specialist mental health services available to treat mental illness. It is also critically important that we have a regional mental health planning project. It's currently reviewing statewide mental health services across all levels of care. The needs of rural and remote residents are a strong focus in that planning. The extensive consultation led to the SA Mental Health Services Plan 2020 to 2025, identifying service gaps and recommendations for new services already being delivered, and a focus for that rural and remote mental health service will be input in the plan from Aboriginal consumers and carers. Implementation of the plan includes the workforce plan, and recommendations from the regional mental health planning projects will be included in the regional local health networks commissioning plans over the next 5 years. I thank the member for bringing the motion to the House.